things that has changed so substantially for healthcare organizations, particularly in Ontario, I think it's true of all of Canada, is that like 10 or 15 years ago, we were using a lot of proprietary systems in the healthcare space. What's happened over the last while, for all the right and good reasons, is we're moving to more industry standard software and systems. The Microsoft suite and all that stuff has become even more embedded into our work processes, that sort of thing, and all for good and all for the right reasons. That has made us a lot more susceptible to attacks than we were before, right? When we were on a lot of these proprietary systems, the hackers, the attackers, they weren't really focusing on that code. They were looking somewhere else. But now, even if they're not aiming for us, we are now part of the collateral impact when they're sending out these hacks and these disruptive tools. Have the equivalent of that one big front door that if you get through, you get all the data and you can take down the system. The bad news is that we've got hundreds of little windows all over the place. And it goes back to my earlier point of people sort of running their own systems in their own organization. And 10 and 15 years ago, probably okay. But now as we move into this new world and you're moving to these more industry standard stuff, if you're not increasing your cybersecurity ability, you're creating a big vulnerability. And I would say that that's one of my big concerns when I think about Ontario and the healthcare landscape is not so much that there's a single access point, but more that there's multiple access points out there, and that any one of those can lead to a problem. And we are going to have to respond very, very quickly. And maybe if it's okay, I'll just invite Lyndon to make a comment about our provincial security approach and how we're trying to offset that a little bit.
Yeah, for sure. Thanks. So, and sort of the things that keep me up at night are the speed of being, needing to address these vulnerabilities and be able to detect and respond. And so across our healthcare sector within Ontario, we're working very closely with our government partners and our delivery partners to ensure that they are building those capabilities to be able to respond effectively and prevent upfront and make those investments and raise the maturity level. And you can imagine in the way that Matt described the environment it is a complex environment. It is a bit of a wicked problem. However, taking a systems-based approach to it is the right tactic, and working collaboratively, and really in Ontario, cybersecurity is a team sport.